Hello everyone, and welcome to this NCLEX-RN medical terms review lesson. In this lesson, we're going to master one of the most important topics you'll see on the NCLEX-RN vital signs, especially heart rate and blood pressure. Many students memorize normal values, but the NCLEX-RN expects much more than memorization. You need to recognize what abnormal vital signs mean, determine whether the patient is stable or unstable, and identify the priority nursing action. In this lesson, we'll cover 4 high-yield concepts: tachycardia, bradycardia, hypertension, hypotension. Let's get started. By the end of this lesson, you should be able to interpret abnormal heart rate and blood pressure rather than simply recognizing numbers. Identify NCLEX-RN priority findings that indicate a patient is deteriorating. Choose the correct first nursing action using clinical judgment. Finally, you'll apply everything you've learned through an NCLEX-RN style practice question. Remember, NCLEX-RN is not asking, "What is the normal heart rate?" Instead, it asks, "What does this heart rate tell you about the patient?" Let's begin with tachycardia. Tachycardia means the heart rate is greater than 100 beats per minute in an adult. One of the biggest mistakes students make is assuming tachycardia itself is the problem. Actually, tachycardia is often the body's attempt to solve another problem. For example, if a patient is bleeding, their blood volume decreases. To maintain cardiac output, the heart beats faster. This is called compensation. Common causes include hypovolemia, hemorrhage, hypoxia, pain, fever, anxiety, and certain medications like albuterol. Whenever you see tachycardia, don't immediately treat the heart rate. Ask yourself, why is the heart beating faster? Your assessment should include oxygen saturation, blood pressure, temperature, signs of bleeding, and hydration status. Now let's talk about red flags. Tachycardia combined with hypotension, chest pain, or altered level of consciousness suggests the patient is no longer compensating. This patient may be entering shock, and immediate intervention is required. For the NCLEX-RN, remember this phrase: tachycardia often means compensation. Always find the cause. Next is bradycardia. Bradycardia is a heart rate below 60 beats per minute. Does every patient with bradycardia require emergency treatment? Absolutely not. Athletes often have resting heart rates in the 40s or 50s. Patients sleeping may also have slow heart rates. The key question is the patient symptomatic? Look for hypotension, confusion, dizziness, syncope, shortness of breath, or chest pain. If those symptoms are present, cardiac output may be inadequate, and the patient is unstable. Common causes include beta blockers, digoxin toxicity, hypothyroidism, myocardial infarction, and increased intracranial pressure. If the patient is symptomatic, the priority treatment is often atropine, or preparation for transcutaneous pacing according to ACLS guidelines. Remember, don't treat the monitor. Treat the patient. Now let's discuss hypertension. Most patients with chronic hypertension feel completely normal. That's why hypertension is called the silent killer. Over time, high blood pressure damages blood vessels and increases the workload of the heart. This leads to damage of the brain, kidneys, eyes, and heart. For NCLEX-RN, the most important situation is hypertensive crisis. Generally, a blood pressure above 180/120 combined with symptoms like severe headache, blurred vision, confusion, or chest pain is a medical emergency. Your nursing assessment should include a neurological assessment, kidney function, urine output, and chest pain evaluation. One important NCLEX-RN concept: blood pressure should not be lowered too quickly. Rapid reductions may decrease blood flow to the brain and cause ischemic injury. Finally, let's talk about hypotension. Hypotension is generally defined as blood pressure below 90/60. Unlike hypertension, hypotension usually means the patient is not getting enough blood flow to vital organs. In NCLEX-RN questions, hypotension is often a late sign of shock. That means compensation has already failed. Look for cold, clammy skin, decreased urine output, dizziness, confusion, and delayed capillary refill. Your priority assessment focuses on perfusion. How well is blood reaching the brain, kidneys, and other organs? Priority nursing interventions include placing the patient in a safe position, administering IV fluids if ordered, and preventing falls. Remember this NCLEX-RN rule. Hypotension usually means instability until proven otherwise. Let's summarize several NCLEX-RN test-taking tips. First, tachycardia usually represents compensation. Ask yourself, what is the body trying to compensate for? Second, hypotension should always make you think unstable patient. Third, never focus only on the numbers. Always assess the patient. Finally, follow your ABCs: airway, breathing, circulation while looking for the underlying cause. Clinical judgment is what separates passing from failing the NCLEX-RN. Let's practice. A postoperative patient's heart rate increases from 88 to 124 beats per minute. What should the nurse assess first? Take a moment to think about your answer. The correct answer is C. Assess the surgical dressing and blood pressure. Why? Because new postoperative tachycardia may indicate internal bleeding or hypovolemia. Although pain can increase heart rate, the nurse must first rule out life-threatening complications. Remember the NCLEX-RN priority: assess before assuming. Before we finish, let's review the key points. Know the normal ranges, but don't stop there. Recognize red flags that indicate patient deterioration. Prioritize assessment before intervention. And always use clinical judgment, not memorization alone. If you can determine whether a patient is stable, compensating, or decompensating, you'll answer many NCLEX-RN questions correctly. Thank you for watching. If this lesson helped you, please like the video, subscribe to the channel, and check out our complete NCLEX-RN medical terminology and clinical judgment course. I'll see you in the next lesson.